Today's video is all about the auto adjuster and all the different things that we can do with it. So what I'm going to go ahead and do is give you a quick tour of exactly all the components of it, and we're going to go ahead and do some demonstrations on different procedures that we can do to be able to help our patients get better faster. One of the greatest things about this device is that it's got a dynamic force setting. If we can go ahead and zoom in on this, that's good right there. What I can do is show you the fact is that it screws down pretty far. There's a nice wide range. It goes from 0 to 50 pounds per square inch. Screwing it all the way down and in will give you a 0 force setting. You'll notice that the impact on my finger, it's very light, and you can just start bringing it up nice and slow. Lower force settings I usually use for cervical spine. I use it for pediatric adjustments and the extra sensitive patient. If we start opening it up, what it does is there's a set screw on the inside, and basically what this is a solenoid-driven device. There's a copper wire in there. The electrical current goes through that copper wire, on and off, polarizes it, and allows an impulse to occur. It is a single trigger device, but you can also go pretty fast with a faster trigger pull. Opening it up to closer to the 50 pounds per square inch, you'll notice it gets a little bit louder. A little bit more current going through, and here you can see the translation of the finger, and that will start getting the bones to move a lot deeper. As far as the different heads that we have on here, we have two different types of dual probes. We have two duals, and we have one single probe, and it's a very easy little set screw that goes in the center here, and we can start off using a single probe, large dual, or small dual. Keeps it really simple. As far as the single probe is concerned, we use this to mimic some of the spring-loaded devices that have been common for the last 30 or 40 years. The cushioned probe is actually replaceable if they ever wear out, which I haven't seen any of them do so far, but these are very easily replaceable and removable. They don't fall off in adjusting. There's a nice tight seal here, but nonetheless, if you ever have to replace them, it's always nice to know that you have a very easy probe to be able to replace and upgrade as necessary. So the single probe, what is this used for? This is probably best used in extremities. You can go ahead and open up, please. And you can also start going into different types of smaller end adjusting, limiting to the upper cervical area. A lot of upper cervical doctors like this probe. It's one of the most commonly used in our profession. But to be honest with you, for adjusting my patients, I usually start off with the small dual, and that's probably the most versatile that I use in my office. One of the neat things as far as having a set screw and not a magnetic device or a clamping device is that you can turn this as necessary to fit the patient. If you have a hand profile and you want to come straight on, say up the top of the shoulders, you can come straight on. If you want to go vertically, you can go vertically just with a twist. It's very easy. You can set it as tight or as loose as you like, and it's just going to be user preference. So before we start into the adjusting demonstrations, I do want to give you our disclaimer. This device is a very, very safe device to use. I haven't come across many devices in our profession that are safer. But the fact of the matter is you do need to use your clinical judgment. We assume no liability in the use of this device. The doctor, the user, has to assume that liability. This is termed a professional device. If you're not a doctor of chiropractic and or a healthcare professional that's trained in the use of these devices, I do warn against using them. There is liability issues that you can run into if you're not a trained professional. So let's go ahead and start enjoying some of the uses, and I'll go ahead and give you some of the demonstrations to give you some more tools in your bag.